Welcome back guys to the channel. Today we are going to start a very important topic, impaction, which is important for both UG and PG students. So let's begin. Impaction. It comes from the Latin word impactus. Coming to the definition, impaction, tooth is one or impacted tooth is one that fails to erupt and will not eventually assume its anatomical arch relationship. Again, impacted tooth is one that fails to erupt and will not eventually assume its anatomical arch relationship beyond the chronological age of eruption. Fails to erupt, does not assume its anatomical arch relationship beyond the chronological age of eruption, and its further eruption is prevented by the surrounding tissue on bone. This definition is given by Archer. Okay, four important things in the definition: fails to erupt, not eventually assume its anatomical arch relationship beyond the chronological age of eruption, and its further eruption is prevented. These are four important things in the definition. Okay, this definition is given in Archer. Okay, one more definition is there of impaction, that is given by Addison et al. It is defined as cessation of the eruption of tooth caused by a clinically or radiographically detectable physical impediment in the eruption path. Cessation of the eruption of tooth. Okay, this is given by Addison, but this definition is more accepted, Archer definition. Now coming to some more terms. What partially erupted? When we will call a tooth a partially erupted tooth? When the tooth failed to erupt into a normal functional position but has crossed the bone barrier and has not reached the occlusal plane. It has crossed the bone barrier but doesn't has reached the occlusal plane. So we will call it partially erupted. What is ankylosed tooth? When the cementum of the tooth is fused to the bone and there is no periodontal soft tissue in between. When the cementum of the tooth is fused to the bone, then we will call the tooth ankylosed tooth. Now coming to unerupted tooth, not perforated into the oral cavity. Not perforated into the oral cavity. Now there is Malpose tooth. What a Malpose tooth? Unerupted or erupted tooth that is in an abnormal position in maxilla or mandible. It can be, Malpose tooth can be erupted or unerupted, but it is in abnormal position. What are ectopic or displaced tooth? Malposition due to congenital factors or displaced by the presence of pathology. या तो पैथोलॉजी के कारण या तो congenital factors के कारण tooth को जहाँ होना चाहिए वहाँ नहीं है. That are called ectopic or displaced tooth. Now coming to some theories of impaction. First theory is phylogenetic theory or disuse theory. वो बोलते हैं ना, जो चीज़ हम लोग यूज़ नहीं करते वो धीरे धीरे कम होती जाती है. सेम अप्लाई हियर. Decrease in jaw function decreases in the jaw size and thus causes impaction. Now there is a Mendelian theory or hereditary theory. If father has large tooth and mother has small tooth or small jaw, or large tooth or mother has small jaw, then there will be lack of space for eruption and it will cause impaction. Large tooth, small jaw, lack of space for eruption, then it will cause impaction. Orthodontic theory, trauma, dense bone or malocclusion will cause hindrance to the tooth movement and jaw growth, which will lead to impaction. Three theory we have read. Phylogenetic theory, Mendelian theory, which is also called hereditary theory. Phylogenetic theory is also called disuse theory, and orthodontic theory. Now coming to the fourth one, endocrine theory. Endocrine disturbances, that is disturbances in the growth factor, decrease the growth of jaw, lack of space for tooth eruption and hence causes impaction. And there is one more interesting theory, that is anthropological theory, which state that enlargement of the size of brain case without the enlargement of the jaw size due to the increasing cerebral folds or the modern diet in man. ये ऐसा इसलिए हो रहा है कि हमारा ब्रेन बढ़ रहा है, जॉ नहीं बढ़ रहा है, क्योंकि जो हमारे सॉफ्ट डाइट है आजकल के और जो इंक्रीजिंग सेरिब्रल फोर्स है उसके कारण. Now this comes to an end of theory. Now coming to the local factors and the systemic factors or etiological factors which are responsible. Etiological factors is given by Berger. They are divided into local and systemic factors. Coming to local factors. Irregularities in the position and pressure of an adjacent tooth. Density of the overlying bone. Long-standing chronic inflammation. What happens when there is long-standing chronic inflammation? It increases the density of the overlying mucosa, hence causing impaction or hence stop the eruption of tooth. Lack of space, underdeveloped jaw, premature loss of deciduous teeth, over-retained deciduous teeth, acquired disease, and necrosis due to infection or abscess. These are all local factors. Now systemic factors, they are divided into postnatal factors and miscellaneous factors. Postnatal factors like rickets, anemia, congenital syphilis, TB, cleft palate, cleidocranial dysostosис and achondroplasia. These all lead to impaction. And then miscellaneous factor, progeria, osteoporosis, cleft lip and palate. Okay. Now coming to coronology, mandibular and maxillary third molars more commonly impacted than maxillary canine and then mandibular premolars. Third molars, then canine, then premolars. सबसे ज़्यादा कौन से मिलेंगे? थर्ड मोलर से इम्पैक्शन, उसके बाद canine, उसके बाद premolars. Okay, there is a statement, teeth erupting late are more commonly impacted. Teeth erupting late are more commonly impacted. Now, this is what for our today's class. What we have read, the definition, some of the terminology, then theories, etiological factors. Okay, now we will see other things in the next class. Till then, like, subscribe and comment. Thank you.